If you take a flu shot, you won't get sick.
If I give it to my family, then they could give it to other people and a bunch of people could get sick.
You get a lollipop after? I'm being really bossy to you because you have to do it.
Aren't we dealing with enough of COVID-19?
If Mom has the flu, she can't go to work and make money.
You have to suck it up and do it because it will only hurt for a second.
It only hurts a tiny pinch.
They put superheroes in your arms to help you get better, sort of, you know?
1, 2, 3, boom, you're done. They do something to help them, I don't know. You will get your flu shot. If you don't have it, well, something bad could happen. You have to go get your flu shot or else. Don't be scared, just get it and be brave.
Jessica, you're on mute.
Sorry about that. So everyone, be brave. I love that message from, they're actually kids of CCSF employees. And so it was so great to create that PSA. Welcome everybody to our first ever SFHSS virtual health fair for retirees. My name is Jessica Shee. I'm the new communications director at SFHSS. I started back in March, right before shelter in place. And I remember how much anxiety I had, you know, like, do I have enough toilet paper? What about Lysol? And I would go online and start ordering things at midnight. You know, I would just triangulate between Target, Walmart, and Amazon until I found what I wanted. But also during that time, SFHSS was working behind the scenes to really educate our members about a lot of the telemedicine services and app-based programs such as Calm, Smiling, Sanvello, and Talkspace that our health plans have to help you with, you know, certain mental health issues, which would have been great for me at the time. I actually do have Sanvello downloaded on my phone and my app, and every day it asks me, how am I doing? How do I feel? Which is a great reminder. And we've also been working to promote services like at-home colon cancer screening. And there are so many ways you can take care of yourself from the safety and comfort of your home, which is why we're having this wonderful health fair today. We've invited a lot of our health plan partners to share what's included in the benefits, all the different ways you can access care during this time. If you can go to the next slide, please. Great. So today is all about you and your health. We want you to make, you know, really well-informed decisions during open enrollment. Just a few ground rules. Everyone will be on mute during the entire presentation. However, you can still talk to us and ask us questions by clicking that little question mark box. Depending on whether you're joining via your mobile device or you're on your computer, if you scroll on your screen, there will be a menu bar that pops up and that little question mark box will be there. And we, at the end of the presentation, we'll have a Q&A session where all of our health plans are happy to answer your questions. And if we aren't able to get to all of your questions at our active employee webinar, we did have more questions than we had time to answer. We will be sure to post them all online at that web address right there, which is sfhss.org/OE2021/FAQ. Next slide, please. So today, this is the agenda. Mitchell Griggs is going to share what's new. Carrie Bashirs is going to share the great well-being programs that we have. And Adam Gunther is going to talk about the Blue Shield of California health plans. Sharon Stanek-Lowe is going to tell you about Delta Dental, and they have some great programs as well. Julie Brady is going to talk about the Kaiser Permanente plans, and Jan Petrella will share the United Healthcare plans, while Ira Schaefer talks about the United Healthcare Dental HMO plan. And then Nancy Jackson is going to talk about our vision benefits with VSP. And then Matthew Smith is going to close it out with some deferred compensation information. And of course, we're going to share our health plans have all agreed to provide office hours so that You can ask them any questions you want. If you have, more detailed information, that's the best time to do it. And we're going to close off the session with our Q&A. Next slide. Great, and now I have the pleasure of introducing Mitchell Griggs, our SFHSS Chief Operating Officer, and he's going to share with you our open enrollment updates.
Good afternoon, I'm Mitchell Griggs with the San Francisco Health Service System, and I want to thank you for joining and participating and having interest in our first retiree virtual open enrollment session. As you know, typically many of you do that. Usually we're here, we can see you face to face and answer your questions. We have many offsites throughout the city, typically during open enrollment, but as I'm sure you're all aware right now in our heightened concern about the safety of our employees and keeping everyone healthy, we're doing our best right now to keep everything virtual. Again, appreciate your attendance. And next slide. During open enrollment or any time during the year, if you need support, it's very important that you look to SFHSS for that support. One of the first stops is the website. We've done a lot of work and we continue to do a lot of work on our website. So the website is a great resource for your first stop to finding out your information or answering your questions. But, ever since March 16th, we've been completely virtual, and we had to close our office on March 16th during the shelter-in-place order, and we have been providing telephone customer service during that time. And so we are here to answer your eligibility and enrollment questions. We help you navigate your benefits through all of our resources, and that means, if I have certain questions about this covered service or that covered service, a lot of that information is in our benefits materials. Our telephone counselors, our benefits analysts that answer our phones can help you resolve those issues. And then accessing your benefits. There are certain programs, your health plan or your dental plan or your vision plan may be providing that you may not be aware of. And so we're here to help you look and find out those nice little benefits that are included in your overall plans. I just want to remind everyone of our member service hours. These are our telephone hours right now. They are 9 to 12 p.m., 9 a.m. to 12 p.m., and 1 p.m., 5 p.m. every day of the week except Thursday. Thursdays, our telephones are operating 10 a.m. to 12 p.m. and 1 p.m. to 5 p.m. Next slide. Again, our website, a lot of work was done in improving our open enrollment pages this year. We had an outreach with members. Some members were calling in. We asked them if they would, have a few minutes to take a survey, and we walked through a survey with them and put some of what they saw and the things that they thought might, be able to be improved on the site and apply that to our open enrollment pages. So there is improvement there. Please take a look. We also send you a benefit booklet for open enrollment. This contains everything that you need for open enrollment. And also in the beginning, on the first page, is a step-by-step guide. These are the thinking processes and then the physical processes that you would need to go through to review open enrollment and potentially make changes if you needed to. Every year we do make a benefit guide. This includes everything in the booklet, plus additional information out there, helpful hints and stuff, but all the benefit information is included in the booklet. This year, our benefit guides are digital. We worked very closely with our printing company, who's also responsible for printing all the election materials for up and down the West Coast. So we had to discuss some things and what we can do as far as our printing. So we'll be printing the full benefit guide that's specifically for the 2021 plan year a little bit later this year, and it'll be available January 1st if you'd like the hard copy, but it is electronic on our website currently. We also have paper enrollment forms. Some of you have access to self-service. Right now, retirees can do their enrollments online. You can go to our website and follow instructions on how to do that. But if you prefer to, or it's better for you right now to do a paper form, you can do that. Those paper forms, some of you got them in your open enrollment packet. If you didn't, then you can get them online, print them, and if you need one mailed to you, we can do that by calling our office. You can fax those forms back in. You can mail them to you through U.S. mail, or you can drop them off in our lobby. We have a drop box there that we pick up every evening. And just for a quick reminder, a lot of you, I get this question a lot during open enrollment, that either you or your dependent spouse or domestic partner are going to turn 65 next year in 2021. What do you do during open enrollment? So if you're currently satisfied with your benefits from now up until you or your spouse becomes 65, there's nothing you have to do for open enrollment. What you need to do is about 90 days before you or your dependent spouse becomes Medicare eligible, you need to contact either the Social Security Administration or CMS to enroll in Medicare. That's 90 days before the first of the month when you turn 65. So when you do turn 65 and you do get that card in the mail, you need to send it to us. And when you send it to us, then we put you in your Medicare plan at that time. So you don't need to make that decision in October this year. Next slide. Along with some of the updates on our website, we try to improve our communications and our global communications as much as we possibly can. And one good resource for you, if you're not already doing so, is subscribing to our e-news. This comes out like clockwork the first week of every month. We have a message from our executive director highlighting some very interesting things that are going on in the health service system, or about healthcare in general. And then we give you every update on everything that's happening. So this is a way to keep on top of everything that's new. And a lot's going on right now, as we all know. And so there are changes that happen throughout the year. So I would definitely go to our website and subscribe to our e-news. It's on the first page at the bottom, and you can sign up from there. Just a quick reminder of a couple of things that are new or going on right now. There's some things with the health plans, and I'm going to let them talk about that. But I want to remind you that health plan premiums change every year. And so it's important that with that open enrollment packet you get, that we show you what your premium is going to be for 2021. So that you're aware of them, you need to look at that. And so that you're aware, and that's in your open enrollment mailing. The other thing I want to remind everyone is that earlier this year, I believe it was early this year, or maybe it was late last year, the city did introduce a new payment portal that all city agency uses, and it's called City Base. So if you make online appointments or you need to make an appointment payment directly to us, you can go to this online system and do that. You can go to our website and look on how to make a payment, and it'll direct you to the portal where you can make those payments. That's it for me. Again, welcome to our virtual open enrollment session, and I will turn it over to our well-being team.
Great, thank you, Mitchell. And now I'd like to introduce Carrie Bashirs, our well-being manager.
Hi, good afternoon, everybody. Thank you so much for being here. You can go ahead and move the slide forward. I'm going to spend a little bit of time just talking about some of the well-being offerings and benefits that you have available to you. So we've moved everything into a virtual platform, which has been really nice because it's easy to access as long as you have availability to either some sort of a web platform or access through your smartphone. So we have a number of different health education webinars and group exercise classes that we do offer online. Some of them are also live and or on demand. We also recently launched our diabetes prevention program and our healthy weight program. So this is something that we currently offer during certain times of the year Right now, those two programs are currently being offered, so the entry is closed. However, look for some more information coming at the beginning of the year, as we'll be opening up and offering additional cohorts once the new year starts. And then as you saw our opening video, flu clinics. We've got a lot of flu clinics happening throughout the city. We actually are going to be releasing 2 additional open clinics at current city worksite locations. We haven't sent out any information about that, but see that coming in the next few weeks. However, if you can't get into one of our clinics, we highly recommend that you visit your healthcare provider to get the flu vaccination this year. And then we also have a number of different online resources as well that you can access through our wellbeing webpage, and I'll go through that link in a little bit. But we have some financial wellbeing information, some resources. There is also a program called Smart Money Coaching for those who live in San Francisco. It's a free coaching program that is specific around financial well-being. And then we have some Setup and Go. So Setup and Go can be really great for those who just want to get up and move around your day. We do know that some of our retirees are actually still kind of getting back into work and doing things. So it's a great resource to be able to utilize just to encourage proper setup, whether you're even sitting at sitting on a couch, or you just need to add movement throughout your day. Go ahead, next slide. One thing that we wanted to highlight is a 4-week challenge that we have coming up starting November 9th. We are in a time where we really need to focus on our mindfulness, our self-care, and our connection. So Work of Art is, like I mentioned, a 4-week challenge that allows you to enhance and practice skills that really focus on gratitude, optimism, and boosting your resilience and happiness. So you will be able to see some information coming out starting October 26th. That's when you can register. And then again, the challenge dates will run for 4 weeks, starting November 9th through December 6th. Next slide. All right, and one thing I think we were missing a slide in there, so I think I'll just go ahead and mention, focusing a lot around mental health and well-being. You know, this is something that we really need to focus on. We always need to focus on, but our mental health is really, really critical. And so I wanted to highlight some resources that you will be able to find. You know, obviously we've got a lot of great resources through your mental health, or sorry, through your benefits. So depending on your health plan, we have some mental health resources there. When COVID hit, our team pulled together a COVID-19 wellbeing resource page, which you can also find on our website, that houses a lot of great information. And then around the month of May, which was Mental Health Awareness Month, we dedicated a web page to also focus on mental health. So again, on our website, you can go in and look at a lot of different resources depending on the different topics that you're interested in learning more about. And then one additional resource that we're really excited to bring forward in the upcoming weeks, launching in November sometime, is a platform called Credible Mind. It is again, a platform that really brings together a lot of the different resources that are out there, podcasts, articles, books, blogs, where you can search different types of mental health and well-being focus areas and find the best fit for you. So if you're one that likes to read books, you can search and say anxiety is the topic, anxiety, look at some books that are out there, and it'll give you some recommended resources that you can learn more about or read about. So for more information, you can go to our website at sfhss.org/well, that's WELL -being, BEING. And I'll turn it back over to you, Jessica.
Thanks so much, Carrie. And if you can go to the next slide. Great. Now I'd like to introduce Adam Gunther, the Account Services Representative for Blue Shield of California.
Thanks, Jessica. Hi, everyone. As Jessica said, my name is Adam Gunther, and I am the Blue Shield rep supporting the San Francisco Health Service System here at Blue Shield. Next slide, please. In the next couple of slides, I'll be discussing the 2 Blue Shield plans offered to SFHSS members which are the Trio HMO and the Access Plus HMO plans. Next slide. The Trio and Access Plus plans have the same medical and pharmacy benefits at the same member copay. However, there are differences between the two plans. The two main differences are member monthly premiums and the networks. The Trio plan has a lower monthly cost to you as a member, but a slightly smaller network than the Access Plus HMO plan does. Both plans still allow members to self-refer to specialists within your own medical group. Both offer urgent and emergent care while traveling both within and outside the U.S. Both offer Teladoc to access virtual consultations for both medical and mental health, as well as our Wellvolution program to all SFHSS Blue Shield members. Next slide. Some of the programs offered only to Trio members include the Enhanced Customer Service with Shield Concierge. The Shield Concierge team includes experienced health advocates or registered nurses, health coaches, and social workers, all co-located with pharmacists, pharmacy technicians, and has a team of dedicated customer service representatives. LifeSpring, a free meal delivery service, and Call the Car, a non-emergent transportation service, are also offered to Trio members. If you're a Trio member, you can check to see if you're eligible for these programs by calling the Shield Concierge team and asking to speak to a Blue Shield case manager. Also offered in the Trio plans is Heal, an on-demand service where a doctor will come to your home, office, or hotel room at a time that's convenient for you, and you'll have access to healthier foods at a reduced price through Healthy Savings. Next slide. Now I'd like to talk to you about Teladoc. Teladoc's a great service offered by SFHSS Blue Shield members at no additional cost. Next slide. So let's say you're at home on a Saturday and you're not feeling well, you can't go see your doctor, and you don't want to go to the emergency room. You can request a Teladoc consultation using your computer by going to blueshieldca.com/Teladoc or via the Blue Shield app on your smartphone. If you don't have access to either of these options, you can call the 800 number and follow the same thing. During your consultation, you'll be talking to a board-certified doctor who will review your symptoms with you, provide recommendations for treatment, and will call in a prescription for you if one's needed. Again, this benefit is at no cost to you as a member and is available 24 hours a day, 7 days a week. Next slide. Another option in the Teladoc program, which is new to SFHSS Blue Shield members in 2021, is access to the mental health professionals. If your consultation is for mental health, you'll be talking to a licensed psychiatrist who can prescribe certain medications, psychologists, therapists, or counselors who are available 7 days a week from 7 a.m. to 9 p.m. So the Teladoc medical portion is 7 days a week, 24 hours a day. The Teladoc mental health is 7 days a week, 7 to 9. These professionals can treat mental health conditions including anxiety, ADHD, depression, grief, stress, and much more. And again, this benefit is also available to you at no additional cost. Next slide. Finally, I'd like to talk to you about Wellvolution, which is available to all SFHSS Blue Shield members 18 years old or older at no additional cost. Next slide. Wellvolution is Blue Shield's digital healthcare benefit available to Blue Shield members 18 years or older. Wellvolution also offers digital health coaching, exercise and nutrition advice, digital tools like weight scales and Fitbit to members who have a health risk. Wellvolution also offers general well-being apps to help you remain healthy if you don't have a health risk or chronic condition. Next slide. To access Wellvolution, you can go to www.wellvolution.com and register. You'll go through a health risk assessment questionnaire for Wellvolution for them to get better acquainted with you, and then you'll be provided with apps and programs that best fit your profile based on the answers you provided to the questions. Next slide. For more information on these or any other benefits or programs offered to SFHSS members by Blue Shield, you can go to our microsite that we developed specifically for you at blueshieldca.com/SFHSS. Thank you for your time.
Thank you so much, Adam. And that was also the website you would go to schedule a one-on-one consultation to talk to, I believe, to talk to Adam directly if you have any questions about the Blue Shield of California plans. And now I'd like to introduce you to Sharon Stanek-Lowe, the National Account Manager for us at Delta Dental.
Good afternoon, everyone. You can see me down below. Hello. Next slide, please. Delta Dental is very happy to provide a quick summary of your healthy smile and how to get your pearly whites, maintain them for a healthy mouth and a healthy you. Next slide, please. So why should you get a dental exam? Well, first, it'll identify dental problems early. You'll also receive an oral cancer screening, and it also can catch symptoms such as acid reflux or kidney problems through your mouth. Next slide, please. A healthy body actually starts with a healthy mouth. By taking care of your teeth and gums, it will improve your overall wellness. Versus poor oral health may worsen diabetes, rheumatoid arthritis, heart disease and stroke, and dementia. Next slide, please. Investing in prevention through regular dental visits actually can save you money. You will pay little or nothing for a cleaning and exam. By seeing your dentist regularly, they can identify any problems that are starting and help you to either stop those from progressing further or recommend treatment for that item. Next slide, please. So your coverage for cleanings. Under the Delta Dental PPO plan, you can receive 2 cleanings in a benefit year, and those will be covered at 100% if you seek services from either a PPO or premier dentist. If you see a non-Delta Dental dentist, you'll receive 80% coverage for that cleaning. If you're enrolled in the Delta Care USA or DHMO plan, you can receive 1 per 6-month period for a cleaning, and there's no copayment to receive that cleaning. Next slide, please. Here's an example of how a tooth could go wrong. So you see on the top, on the left-hand side, a filling out-of-pocket cost around $33. Then at the far end of the spectrum, the worst case scenario of that teeth really going wrong and severe decay, a dental implant would be needed. Whereas a healthy tooth, no out-of-pocket expense. So please, please see your dentist for that cleaning and the exam. Next slide, please. Your oral exam. So typically an oral exam is done in conjunction with a cleaning. And your coverage for oral exams under the PPO plan is 100% for 2 oral exams in a benefit year. And if you seek services from a non-Delta Dental dentist, 80% coverage for 2 oral exams as well in a benefit year. And there's no copayment if you are on the Delta Care USA plan for oral exams. Next slide, please. Grandkids are at risk for decay, so help your grandchildren keep a healthy mouth by recommending that they seek services from a dentist at least once a year. For children that are of age 1 year or older, that's when they start and need to seek services from a dentist. Next slide, please. Boosting your benefits. You can enjoy added coverage if you're diagnosed or have been diagnosed with heart disease, stroke, rheumatoid arthritis, diabetes, HIV, or AIDS. By enrolling in the opt-in SmileWay Wellness Program, and that can be done either by calling the telephone number on the screen or 888-335-8227, or you can also enroll or opt into this program online through the online portal. This benefit affords individuals that are opt-in or enrolled in the Smileway Wellness Program 100% coverage for one scaling or root planing procedure per quadrant per year, an any combo of 4 of the following per year: cleanings covered at 100% or gum maintenance covered at 100%. This benefit is linked to members that are enrolled in the PPO plan, not the DHMO. So again, PPO plan, if you're enrolled, then please and also opt in to the Smileway Wellness Program to get additional benefits if you have one of those 5 chronic conditions. Next slide, please. There's also on our microsite for SFHSS a Smileway Wellness Center. And that center that's on the microsite, and you'll see it actually labeled Smileway Wellness, but with our nice little logo on the screen, the person holding up the little sign. You can receive additional information on dental, such as 100 and plus articles on everything from acid reflux to x-rays. There's also short videos, tooth-friendly recipes. There's a risk assessment tool, as well as some quizzes. So please check that out at the website, mysmileway.com, or going through your microsite, which we will show on the next slide, please. So visiting the microsite, that's in the middle of the page, and that's at deltadentalins.com/CCSF. You can also call us. The toll-free number for the PPO plan, 888-335-8227, or the DeltaCare DHMO plan, that's 800-422-4234. Again, this contact information is listed on the microsite. It's listed in your enrollment guide. Please seek services either through going to our website or by calling us to get more information about your benefit highlights if you have specific questions about your plan. Thank you, and I appreciate your time today.
Thank you so much, Sharon. And now I'd love to introduce Julie Brady, the Executive Retiree Solutions Manager for Kaiser Permanente.
Thank you very much. Next slide, please. So I want to thank everybody for the opportunity to present the Kaiser Permanente benefits for City and County of San Francisco retirees. Kaiser Permanente can help you get to your healthy place no matter where it is. Next slide. We're both a care provider and a health plan, which makes your life easier. Your doctors, hospitals, and health plan work together, and your personal doctors, specialists, and nurses are connected to each other and to you through our electronic health record system. You get personalized care because they can see your health history, like your conditions, medications, and allergies. Next slide, please. When you need care, you can have an appointment in person, over the phone, or by video. You can get advice 24 hours a day, 7 days a week, over the phone or online. And you can email your doctor's office with a non-urgent question and get a response, usually within 2 business days. You can also schedule or cancel routine appointments online, refill most prescriptions, check most lab results and appointment histories, and even pay a bill. Since the COVID-19 outbreak, over 80% of care visits have been by video or phone at Kaiser Permanente. Next slide, please. And just to give you a little bit more information about Kaiser and COVID, we have a website. It's kp.org/coronavirus, where we offer frequent updates regarding this new virus, including how to prevent it and what to do if you have symptoms or other concerns. You'll find links to begin an e-visit with a nurse, connect you to the pharmacy center, or read articles with tips on how to keep you and your family safe. You can also find any updates regarding temporary facility closures that may be impacting your area. We have reopened some facilities that were temporarily closed, and we continue to do so as our safety allows. But of course, we do have these virtual and telehealth appointments, which you can take from the comfort of your home, and you won't have any exposure to the virus. You also do not have any co-payment for those phone visits and video visits. However, if for some reason you do need to come in to see your doctor or specialist, that can be available to you. Your doctor would make that determination whether you need to come in, and then which facility has the specialty that you need. And don't forget, please take advantage of our mail order prescription coverage to have your prescriptions mailed directly to your home now during COVID-19, and even beyond as a good convenience for you. Next slide, please. We're committed to caring for the whole you so you can achieve optimal health in mind, body, and spirit. We provide clinical and support services for a wide range of conditions, including anxiety, stress, depression, substance use disorder, and autism spectrum disorders. Our mental health team includes psychiatrists and psychologists, as well as marriage and family therapists, addiction medicine physicians, and medical social workers. And remember, you don't need a referral to mental health care within Kaiser Permanente. And you can learn more about that at kp.org/mental health. Next slide, please. Here are some of the ways that we are helping you thrive during COVID-19 and beyond. The first one is LastPass and some self-care apps, Calm and My Strength, which I will talk about on the following slides. We do have wellness coaches available to you at no cost. They're available by phone. You are assigned a wellness coach who works with you to make a plan of action and then have some regular check-ins on something that you want to change, whether that's to lose weight, develop an exercise routine, stop smoking, reduce your stress. And I think right now, with everything that's going on, this is a great service for people to take advantage of. You can join a program to help you lose weight, reduce stress, quit smoking, and more at no cost to members. And you can find helpful videos and articles, health calculators, recipes, and more online. You can get special discounts on products such as massage therapy and home gym equipment as well. And of course, right now we don't have a lot of our health taking place at facilities, but once we are able to reopen, each of our facilities have a variety of different on-site classes that you can take. Next slide. So I want to talk a little bit about ClassPass. This is free to you. It offers at-home workouts so you can get moving with fitness options for your schedule and lifestyle. You have access to 4,000 plus on-demand fitness classes, and you can also take advantage of reduced rates on live stream and in-person video classes. So to look for that and register, you would go to kp.org/exercise. Next slide, please. And the next two slides or apps on this slide that I want to share with you are Calm and My Strength. So Calm is a well-known app that uses meditation and mindfulness to help lower stress, reduce anxiety, and improve sleep quality. Everybody 18 or older has access. If you're a Kaiser member, you have access to this app. And then My Strength is designed to help our members support their overall well-being in many mental health and wellness areas, including managing depression, reducing stress, and improving sleep. And you can see how to download those apps at kp.org/self-care apps. Next slide, please. And coming up in these slides are a few things that are just for our Medicare members. The first one is rides. So you can get rides to and from your appointments at no cost. Your plan covers up to 24 one-way trips of up to 50 miles per trip per calendar year. You can get rides to doctor's appointments, medical services, picking up medication or equipment. And what's available to you is rideshare, taxi, private transportation, and if needed, wheelchair van, or gurney van. Next slide, please. The next one is a meal benefit for you, and that is new for 2021. With post-discharge meals, you can get up to 3 meals a day for up to 4 weeks following a discharge from a hospital or skilled nursing facility. The meal benefit can be used once per calendar year. They are mailed to your house or shipped to your house, and they're designed to be refrigerated and then heated up in a microwave oven or a regular oven. In addition to general health, there are a variety of condition-specific menus for diabetes, renal, low sodium, and gluten-free. And then the next slide, which I'm going to close with this next slide. This is our Silver and Fit Exercise and Healthy Aging program. City and County of San Francisco Medicare retirees have had this benefit for quite a few years, but we definitely want to remind you, you do have access to a number of different benefits. You've got a gym membership, a free basic gym membership at a participating facility, which obviously many gyms are closed right now, but you also can have access to up to 2 home fitness programs mailed to your house on topics such as Pilates, stress management, and chair dancing. And you can also go to silverandfit.com to see the locations, order kits, and access other fitness tools, and download the Silver and Fit app, where they are doing virtual fitness classes through that app as well. So we can just forward to the, close out for the next 2 slides. And that is all. Thank you very much.
Thank you so much, Julie. And I just want to have a reminder to the presenters, feel free to go into the Q&A if there are questions that you know are specific to your plans. Please feel free to help our members in the Q&A session. And now if you can go to the next slide, on this slide, I'd like to introduce Jan Petrella, the Client Service Manager for United Healthcare.
Hello, and thank you for taking the time to learn more about the United Healthcare Group Medicare Advantage PPO plans designed specifically for the San Francisco Health Service System. There is a plan available for those with Medicare Parts A and B, and another plan for those with Medicare Part B only. Both plans have the same benefits and coverage. During our time, next slide, please. Thank you. During our time together, we will be reviewing your plan benefits, programs, and features, and what to expect after you decide to enroll. Next slide. The United Healthcare Group Medicare Advantage PPO plans will cover all the benefits of Part A, your inpatient, hospital, skilled nursing, and home health, as well as the benefits of Part B and the Part D prescription drug coverage. As well, we offer some additional benefits and programs. You will still be considered to be covered by Medicare, but all of your claims will be administered by United Healthcare. Next slide. Your United Health Group Medicare Advantage PPO plans are national PPO plans. What that means to you is that you'll be able to see doctors, clinics, and hospitals all across the United States and within the U.S. territories. Under the plan, there will be coverage for podiatry, vision, hearing, chiropractic care, and acupuncture, as well as prescription drug coverage. Additionally, these plans do not require referrals to see a specialist. Next slide, please. The National PPO plan lets you see providers in or out of the United Healthcare network for the same cost to you as long as the out-of-network provider participates in Medicare and accepts the plan. This means they would be willing to bill United Healthcare. The provider you're currently seeing may already be in the United Healthcare network under this plan. To confirm if your provider is in the network, you can check online at uhcretiree.com/SFHSS or by calling the United Healthcare customer service line. The customer service team may also be able to assist in confirming if the provider participates in Medicare and accepts the plan. Next slide, please. Under your plan, there is no deductible, and the annual out-of-pocket maximum is $3,750 for covered medical expenses. Next slide, please. You will pay $5 for a primary care office visit and $15 for a specialist visit. You will pay a $20 copay when you visit an urgent care facility. You will pay $65 when you visit the emergency room. The copays for urgent care and emergency are waived if you are admitted within 24 hours. You will pay a $150 copay for inpatient hospitalization stay, that is per stay. You will pay $100 for an outpatient surgery. Next slide, please. Under this plan, all preventive services such as annual physicals, immunizations, breast cancer screenings, colon cancer screenings are covered at no cost to you. Next slide, please. This slide shows some of the additional benefits included with this plan. You're covered for routine podiatry or foot care for up to 6 visits per year. Your cost is a $15 copay per visit. Your routine hearing coverage provides 1 hearing exam per year at no cost to you and a $5,000 hearing aid allowance every 3 years. You're covered for 1 routine eye exam per year and you will pay a $15 copay. You have up to 24 routine chiropractic visits per year under this plan available to you with a $15 copay per visit. You also have up to 24 acupuncture visits available per year under this plan, and you would pay a $15 copay per visit. Next slide, please. Your plan includes prescription drug coverage, also known as Part D, as in dog. You have the option of choosing over 6,000 United Healthcare in-network pharmacies. There are thousands of covered brand name and generic drugs on our list available to you. You can check the plan's covered prescription drugs by going to uhcretiree.com/SFHSS or by calling customer service. This slide shows what you will be paying for prescription drugs. There's 4 tiers. You do have available to you retail, a 30-day supply, and also up to a 90-day supply at mail order. Under Tier 1, this would be all of your covered generic drugs, and you would pay a $5 copay for the 30-day supply at retail or a $10 for 90-day at mail order. Tier 2 drugs include many brand name drugs, also called preferred brands, and you would pay a $20 copay for up to a 30-day supply at retail or a $40 copay for up to a 90-day supply at mail order. Tier 3 includes non-preferred brand drugs, and you would pay a $45 copay for up to a 30-day supply at retail or a $90 copay for up to a 90-day supply through the mail order. Tier 4 includes specialty drugs. You will pay a $20 copay for a 30-day supply at retail or a $40 copay for up to a 90-day supply at mail order. Next slide, thank you. More ways that you can save under the plan. Do make sure that you review your medications with your doctor yearly. Often drugs change classes and there may be a less costly drug or a new one potentially that's been developed that could help you stay healthy, but also may save you some money. So reviewing your medications with your doctor can help you determine that. Make sure to use your United Healthcare card when you go to the pharmacy. Use participating pharmacies to help lower your costs. And also, if you choose to use the mail order through OptumRx, you could receive that 90-day supply of your medication for 2 copays, saving you 1 copay. Next slide, please. If you're already a member of United Healthcare Group Medicare Advantage PPO and you're happy with the plan, you do not need to do anything and you will remain enrolled for 2021. Both newly enrolled members and those who are already enrolled will receive a new member ID card in December, along with a quick start guide that gives you more information about how to get the most out of your plan. You can start using your member ID card as soon as your plan becomes effective. We do encourage you to register online at uhcretiree.com/SFHSS to access additional plan information, view claims, and even view your explanation of benefits. You will need your member ID card with the ID number in order to register. If you're new to the plan, we will contact you soon after your effective date and welcome you. Next slide. We are excited to introduce our new virtual education center where you can learn more about the benefits, programs, and services available to you as a member of our plan. You can also view flyers and brochures and videos. That web address, as you see on the screen, is uhcvirtualretiree.com/SFHSS. And on behalf of United Healthcare, we want to thank you for your time today, and we look forward to welcoming you to our Medicare family. Or if you're already a member, we welcome the opportunity to continue to serve you.
Thank you so much, Jan. And that web address, the SFHSS microsite for United Healthcare that she showed 2 slides ago, that is also how, if you have any questions, you want to set up an appointment to speak with someone about your particular situation at United Healthcare, they also have office hours available, and you can sign up for one of those hours there. And now I'd love to introduce Iris Schaefer, our Field Account Manager for United Healthcare Dental HMO Plan. Thanks.
Thank you. Thanks for the welcome. And thank you to everyone who has actually taken the time today to learn about their plans offered by their employer and by United Healthcare. This presentation is it's a brief overview of the coverage for the dental plan. Next slide. Next slide. Having a United Healthcare dental plan helps make it easier for you to take care of your teeth and gums. A good oral health not only gives you a healthier, beautiful smile, but it also plays a role in your overall health. Next slide. With this plan, you can save money and invest in a healthier smile to last a lifetime. Under this plan, there is a network of provider groups who have agreed to offer specific services at negotiated rates to United Healthcare members. Each family member has the flexibility to visit the dentist of their choice in our network. And a member must visit a primary care dentist from the regional network available in their area. Your primary care dentist will coordinate your dental care needs, including referrals to specialists if needed. Also, there's no waiting period under this plan. Next slide. To get dental coverage, you must be an eligible employee or retiree with the City and County of San Francisco. And if you purchase coverage for yourself, dependent coverage is also available. Next slide. This is a simple, low-cost plan that offers coverage for a range of dental services. You can see any general dentist in the network that you want. If you choose to see a dentist that is not in our network, you won't receive coverage, so it's important to stay in the network. You may also see this plan referred to as a direct compensation plan on our website and other materials. Next slide. With this plan, it's your choice when it comes to dental care. The first step is to choose your primary care dentist, and each family member can choose a different dentist if they want. You do not need to contact United Healthcare to select a dentist. You choose any general dentist that is in our network. When you visit your dentist, just show your ID card, and you'll have the advantage of the negotiated rates. You'll be responsible for the office visit copay and specific copay for each covered service based on your plan design. And they will submit the claim for you. Next slide. Your dental member website myuhc.com, offers information and easy-to-use tools to help you get the most out of your dental plan. You can find a network provider in your area. You can view plan information and find answers to commonly asked questions. You can also download and print an IT card if you need to. Thank you next slide. Thank you very much for taking the time to review and listen about your dental options through United Healthcare and through your employer. But please do take time to review plan materials. Those materials are available on welcome-to uhc.com/SFHSS. Thanks so much for your time.
Thank you so much, Iris. And that website is also where you can schedule a time to talk to a United Healthcare representative about any questions that you have. And now I'd love to introduce Nancy Jackson, the Market Director for VSP.
Hi, good afternoon, everyone. As Jessica mentioned, my name is Nancy Jackson, and I'm here today to provide you with an update on your VSP benefits. Next slide, please. So as you can see here, SFHSS does offer its members two plans, a basic and premier plan. Some of the main differences between the two plans are the frame allowances as well as frequencies of when you can get frames, along with the contact lens allowances and frequencies as well. Under the premier plan, you also do get coverage for premium and custom progressive lenses with a $25 copay and anti-reflective lenses with a $25 copay. Both plans do currently offer VSP's primary eye care program, which actually allows you to go to your VSP provider for medical vision issues such as pink eye for a $5 copay. Next slide, please. So this is just a sample member out-of-pocket comparison for you. It compares the usual and customary charges for an actual SFHSS claim that we've received and what your out-of-pocket would be under the VSP Premier plan. So as you can see, the savings between the two plans for the same claim is just over $850. Next slide, please. VSP does offer a wide variety of options within our network. SFHSS members are able to choose from either an independent private practice doctor to retailers such as Costco or VisionWorks. And of course, we also have our online retail store, iconic.com. Overall, nationally, we do have over 96,000 in-network choices for you to choose from. Next slide, please. So just a bit more information on iconic.com. It's actually the only online retail space where members are able to use their VSP benefits. You can actually load your prescription, which is always hand checked by the optometrist that we have on staff, and select your frames and lenses or contacts. And we also have a pretty fun virtual try-on tool where you can scan a photo and virtually try on frames that you've selected. Next slide, please. And I also wanted to take this opportunity to remind you of some of our extra discount programs. VSP does offer an extra $20 towards frame allowances on certain featured frame brands, and a complete list of qualified frame brands are available on VSP.com. And on Iconic, you do get an extra $20 also on non-prescription sunglasses if you decide to purchase it through there. And then we are continuing our partnership with True Hearing, which is a national network of audiologists. And as a VSP member, you not only get a discount on hearing exams, but also up to 60% off hearing aid devices. And all of these discount programs are available on VSP.com with more information. Next slide, please. So using your benefits is super easy. Once you're enrolled in either the basic or premier plan, you can create an account on VSP.com where you're able to check eligibility, see what your benefits are, and search for providers and much more. You can also call our 800 customer care line to get a provider list in your area, or if you have any questions about your benefits. With VSP's plan, no ID cards are needed at the time of service. However, beginning January 1st, SFHSS has members will have the option of using a VSP assigned unique member ID so that you're not having to use the last four of your social security number. So you will be receiving a welcome letter in early January of 2021 with a member ID card, or you can also obtain the card through our website at vsp.com. Next slide, please. So this is just a sample of the member ID card that you can either print out on vsp.com or that we will be sending to you early January. Next slide, please. And then I just wanted to remind you that if you do enroll into the Premier plan, and if you are enrolling any dependents, your dependents must also enroll in the Premier plan as well. Next slide, please. And so as you are aware, your open enrollment does end at the end of this month. So please enroll in your VSP benefits before then. And if you have any questions, please contact us at the 800-877-7195 number or at vsp.com. Thank you.
Thank you so much, Nancy. And now I'd like to introduce Matthew Smith, our Voya retirement counselor.
All right, so go ahead and actually go on to the next slide, because with the deferred comp, you can actually enroll it at any time. So thanks for attending today's presentation. Again, my name is Matthew Smith, and I am one of 5 retirement counselors that support the San Francisco deferred comp plan. Go ahead and go to the next slide, please. And my 2 main departments happen to be Fire and Department of Public Health. My colleague Tony Chu, he actually covers HSS. And so a lot of folks ask us, hey, what's the difference between deferred comp and SFRS pension? So with your SFRS pension, you don't really need to make any decisions. You don't choose how much you save. You don't choose the investments. It's all kind of done for you. Whereas deferred comp, you need to make a lot of decisions. You got to choose how much you want to save and how you want to invest the money. And it's my job to help you with those decisions. And like I say, I have 4 other colleagues. There's 5 of us to support the city of San Francisco. So a couple of common questions you have to answer. You got to choose how much you want to save. You can also choose if you want to save money, either the traditional pre-tax or the new Roth after-tax. And one nice feature is that the plan's very flexible. You can increase, decrease, start, stop at any time. It's not like health insurance where you only have a week or 2 to make a change. No, deferred comp is very flexible. Now, sometimes people say, hey, what is a deferred comp plan? Well, if you were to work for a corporation, then you might get what's called a 401k. If you were to work for a public school or a nonprofit, then you might get a 403b. You work for the city, so you get what's called a 457B deferred comp plan. It's basically the 401k for government employees. Why don't you go on to the next slide? So one big question you got to answer is how much that you want to save. I basically see 3 types of people. The first type of person, they want to max out. They say, hey, the tax man's killing me. This is really important. I know I got to save money. Well, the maximum, if you're under 50, is $19,500. If you're over the age of 50, it goes up to $26,000. And if you've been with the city for a number of years, then you might qualify for what's called a special catch-up. The special catch-up would allow you to save up to $39,000. If you want to do the special catch-up, please reach out to your counselor. There's some extra paperwork that we've got to fill out for you. And like I said, we're happy to help out with that. Now, lots of people would love to save $19,500, but they have to eat. So let's talk about some numbers that are a bit more realistic. A really good goal that we coach is 10 to 15%. If you're doing 10 to 50%, you're going to make some solid progress. And that's not Matthew or Voya or the city or whatever. That's from the Department of Labor. You go to the Department of Labor website, guess what they recommend everybody save? Yep, 10 to 15%. And we recommend a percentage more than a straight dollar amount. And that's because a percentage is going to follow your income. So as your career advances and you get raises and promotions or whatever, if your income changes, then a percentage is going to follow that. Now, I get it. For some people, 10%, that's still a lot of money. And you got tuition and daycare and rent and food and 3 boyfriends, and it's just not easy out there. So if things are tight, that's fine. Start at 5, start at 3, and then you can slowly bump it up. A really popular time to do an increase is July. Go ahead and go to the next slide. Like I say, July is a really popular time because you often, this is not guaranteed, right? But city employees often get a raise in July. So like I say, that's a popular time to do an increase, okay? Now, we sometimes see folks enroll even right before they're going to stop working with the city. Now, if they do that, it's often because they have unused vacation hours. I mean, I see folks with 100, 200, 300, even more hours of unused vacation pay. Well, if you get paid out on that, the IRS might love you. So what do? You can defer those unused vacation hours into the plan. It is my understanding that those unused vacation hours get deposited about 75 days after your last day of work. And it comes under the contribution limit for that calendar year of the deposit. As a result, we sometimes see folks retire intentionally in November or December with the strategy that those unused vacation hours will be deposited after January 1st and come under the following year's contribution limit. See, these little strategies. Go ahead and go to the next slide here. So again, if you want to take advantage of that, please contact your counselor and we can help you fill out the paperwork to do the unused vacation hours. Now, also, if you happen to have an eligible shortage with your FERS pension, you can use money in your deferred comp to buy back that time. And it doesn't have to be deferred comp. You can use any pre-tax source, old IRA, old 401k. You can use that money to buy back time with FERS. If you want to do that, go ahead and contact the folks over at mysfers.org and they can help you with the time buyback. Next slide. So it is kind of fun to think about retirement, right? I mean, someday you're going to travel and take on new projects and all kinds of fun things, right? Right? Yes, yes, yes. But here's the big question. How long are you going to live? So my grandma, Betty, she made it to 92, and my grandma Mildred made it to 96. And I told my wife, you are not going to get rid of me. Nope, going to be around a long time, which is great. It's great that folks are living a long time, but with that comes responsibility, right? You're going to have to save some money. You got to do it. You got to do it, okay? So a couple of the features of the plan, go ahead and take the next slide. Yeah, the next slide here. And so some of your options when you stop working with the plan, most people leave their money with this plan. And there's a couple good reasons why. One, you have very low cost institutional funds, very low cost funds. So people like the low cost of the plan. Second reason, one of the funds is called the Stable Value Fund. It currently pays a guaranteed 2.19%. So good luck finding that anywhere else. Also, there's no transaction costs, no front load or back load or broker fee or anything like that. So because there's no transaction costs, you got a Stable Value Fund that pays a good interest rate, and you have very low cost funds available. People like this plan. They tend to leave their money in this plan even after they retire. Go ahead and go to the next slide, please. Okay, so like I said, you can leave the money in the plan, and that's what a lot of folks do. You don't have to do anything until the age of 72. And at age 72, that's when they have what are called the RMDs, required minimum distributions. And then you'll have to pull about 4% of the account every year and pay the taxes. Another nice feature about this plan is that there's no age requirement. If this was an IRA or 401k or 403b, you would need to be over the age of 59 and a half to pull the money without a penalty. On this plan, you can be 39 years old, stop working for the city, and you can pull your money penalty free. There's still taxes. You can't avoid the taxes, but there's no penalty. Now, this really only applies to the pre-tax. On the Roth after tax, you still have that 59 and a half-year-old rule. But like I say, a lot of people, they leave their money in this account, and it just keeps growing with the market until they choose to pull the money. All right, go to the next slide, please. Yeah, and although, you know, it can keep growing, you still got to take those RMDs starting at age 72. One kind of interesting thing here in 2020, because of COVID nonsense and all that stuff, there's actually no RMDs required this year. So for anybody out there that's 72 or older, you don't even have to worry about this kind of stuff here in 2020. because like I say, there's no RMD to worry about this calendar year. Okay. Again, accessing your money, it's very, very flexible. You can pull the money as you want, when you become retired. The strategy on pre-tax money is you tend to leave it in the plan and pull little bits every calendar year as you need it. Roth, on the other hand, is nice because you can pull that money totally tax-free. So pre-tax money, that's kind of that long, steady stream of income. Roth, you can do that boom, big ticket item, buy that new car, send that kid to college, whatever you like, and that's all yours, totally tax-free. Okay, so I see the benefit of both. All right, yep, next slide, keep going. Nice. You do want to be careful that whenever you do take a pre-tax distribution, that is considered regular taxable income for that calendar year. And the IRS is automatically going to take 20%, and the state of California is automatically going to take 2%. Now, some people flip out. They go, oh my gosh, I got to pay 22% taxes. No, that's just the automatic withholding. You don't really know how much you owe until you file in April of the following year. So if you don't have a lot of other taxable income, then you can assume that you don't have to pay, maybe you might get a refund of that money. All right, go ahead and go to the next slide. Okay. If you want, you can roll it over to an IRA. Next slide, please. So a couple things to remember. Annual contribution limit is, if you're younger than 50, again, is $19,500. If you're age 50 or older, it goes up to $26,000. And if you really want to throw in, you might be able to do special catch-up, which would allow you to save up to $39,000. And again, if you're going to retire fairly soon, you think about doing a lump sum payment into the account. And this is actually, a lot of folks, they tend to retire in November or December with the goal that those unused vacation hours will be deposited the following year. And again, when you stop working with the city, you can keep your money in the plan. You can do partial distributions. You can roll into an IRA if you really want. You can buy back time with SFRs if you really want to. Next slide. So a couple other extra questions. Can I buy stocks? Yeah, there's 13 core funds that are available. Large caps, small caps, baseball cap, all kinds of stuff. No, I'm just kidding, folks. If you want help with the allocation, please contact your counselor. We can help you choose the funds, help you make a good educated decision. A lot of folks take advantage of what are called the target date funds. Those are really, really popular, put you into a nice diversified portfolio. There is a loan available on this, and so that's a nice feature. The nice thing about a loan is that there's no taxes and no penalties, so that's good. And when should you update your beneficiary? Basically, any big life event, death, marriage, kids, all that good stuff. And again, the investment options, you have 13 core funds available, including very low-cost index funds, and target date funds are super popular. Go ahead and go to the next slide. So again, don't be shy. Talk to us. Contact your counselor. The counselor sheet is available. Everything's available at sfdcp.org, the San Francisco Deferred Compensation Plan. That's where you can identify your counselor. Again, I happen to have FIRE and DPH. Tony, my colleague, has HSS. And you can book a meeting via Zoom at a good date and time for you. Thanks, folks. Don't be shy. Contact us.
Thank you so much, Matthew. That was great. And as a reminder,
my first rodeo.
We love it. As a reminder, all presenters, there are a lot of questions, so feel free to jump on the Q&A and start answering them directly. And if you can go to if you can jump one slide to the next slide. Great, so I really wanted to get to the questions, but I want to let everybody know how you can reach your individual health plan reps for office hours. So for Blue Shield of California, on their microsite for SFHSS members only, you go to blueshieldca.com/SFHSS. And for KP, you would go to my.kp.org/CCSF. And for United Healthcare, you would go to welcome-to-UHC.com/SFHSS. And that's how you can click on those buttons that you see on the slide below. It's on their homepage, and that's how you can access office hours. And now we've got 46 events in questions in the queue, so we're going to try to get through as many as we can in this limited time. I hope our presenters will have some time that we can spare. If you can go to the next slide, Anthony. Great. So everybody, this is our contact information. You can always contact member services if you have any questions. You can see the phone numbers listed there along with our operating hours of when you can reach them. In the meantime, I'd like to jump into the first question we have, which is for Delta Dental. And actually the first two questions are very similar, so I'm just going to ask. Sharon, are you still there?
I am.
Thank you, thank you. So is the cost of an oral surgery to remove impacted to counted toward the maximum? And we have another participant who also asked, does emergency treatment for a dentist visit also go against the $1,250 maximum per calendar year?
Yes, so for both of those questions, the answer is yes. The only items that are excluded from the calendar year maximum or annual maximum would be your cleanings, exams, and then the benefits under the Smileway Wellness Program if you've opted into that program. Everything else would apply to your annual maximum.
Great, and we love that Smileway program. Please, if you qualify, please participate. So this is for Blue Shield of California. Adam, are you still here?
I am.
Oh my gosh, thank you. So currently we have a member who's on Blue Shield Trio, and he wants to know, what is the difference between Blue Shield Trio versus Access Plus HMO? Are there certain facilities like Sutter Health, are no longer taking Brown and Tolan? Could you elaborate and provide some clarity?
Yes, the difference between the two plans, as I stated earlier, is that there's a lower cost share to the member for the Trio per month, and there is a slightly different network. The Trio does have a slightly smaller network. Now, what they're talking about there is a contract negotiation going on between Brown and Tolan and Sutter. Blue Shield is not part of that negotiation as it's between those two entities. And there are certain specialties and clinics that have fallen out of the Brown and Tolan network due to this negotiation. But members in Brown and Tolan in the Trio plan can still access facilities like CPMC. There's just certain specialties that have fallen out of the network. And I do know those contract negotiations are still ongoing, but unfortunately, Blue Shield, we are not privy to that as we're not part of those negotiations.
Thank you, Adam. And is Jan available? We have a question about why are there two different rates for United Healthcare PPO? I know the HMO says not available, so I guess they only have the PPO price.
This is Shannon, and there's a rate for folks with Medicare A and B, and then there's a different rate for those with Medicare Part B only.
Okay, thank you so much. And we have the pamphlet states that none of the HMO plans are offered in my geographic area, and United Healthcare would be offered with lower premiums. Is this true? And how do I initiate this? I think it depends if you're a retiree or if you're still working with the city of SF. And is Mitchell still on the line?
Yes.
Okay. If they're a retiree and they don't live in an area where HMO is offered, and they have to be on United Healthcare PPO, is there a lower premium?
If they're non-Medicare retirees.
Okay, so if you're a non-Medicare retiree, that is correct.
Yeah, if they live out of the Bay Area, there is a lower premium for city plan PPO.
Right. So, and then the next call is actually about the flu shot for people 65 and older. It is true, we recommend you get the high dose vaccine. It doesn't mean that it is available everywhere, but the best flu shot is the one you can get. So if you can get a flu shot, take that flu shot. you know, always ask if they have the high dose vaccine available for you if you're 65 and older, but if they don't have it, just get the one that you can get. That's our recommendation. And we actually have a flu prevention page that Carrie probably mentioned earlier, where there are multiple ways, depending on which plan you have, for you to get your flu shot. For UHC and for Blue Shield of California, you can go to local pharmacies as well as go through your provider. For KP, they have everything from walk-up clinics to drive-through clinics. And for retirees with Medicare, what is the health plan if he or she is living outside of the United States? Shannon, are you still there?
I am, but I believe they would go on to the city plan if they live outside of the United States. The Medicare Advantage PPO plans are not available if you do not reside in the United States.
Thank you for that. And Nancy, I don't know if you're still here, if you had to go.
I'm here.
Someone asked if for VSP is the only box I check if I want to change vision plans. I believe your basic VSP plan is included. It's tied to your medical plan. But if you want VSP Premier, you would have to elect for that. And everybody in your coverage would also get Premier. Nancy, is there more you can add to that?
No, that's how I understand it as well.
Great. And Sharon, I've got another Delta Dental question. When did Delta Dental start allowing 4 teeth cleanings per year instead of 2 for people with diabetes and other such conditions?
We started the Smile Away Wellness program January 1st of 2019.
Great, and we do encourage, if you qualify, if you have medical conditions that qualify for you to get Smile Away, please sign up. And back to Adam, I don't know if he's still available. Why might someone get Access plus HMO versus TRIA? What are the principal, you know what, he did talk about the principal differences earlier. It really is about the network doctors. So I'm going to jump to the next question. Could you do a brief overview of retirees on Medicare, but not yet on Social Security? Mitchell, is that a call for member services?
Yeah, so I think what they're asking is they're not yet in Medicare.
They are on Medicare, but not yet on Social Security.
Yeah, they should contact member services. You would need to look into that.
Yeah, so that number on the screen right now for member services, if you reach out to them, they can help you clarify that. And I think we're going to take one last final question, and just know that we will post all of the answers on our website under the retiree section, so that these are just for you and your questions. So for the final question, the cost for retiree plus spouse for Blue Shield, I could not find the booklet that was mailed out. Okay, well, then the spouse is in the United States, it's great. And you're currently on Blue Shield. Okay, wonderful. Well, the booklets are also available online at our website. If you didn't get it in the mail yet, you can certainly look online at sfhss.org/OE2021. And if you are an early retiree, or you can always look under the retiree link and find your information there. So we will answer all of your other questions online. Thank you so much. We had more than 50 questions on this, and I think over 100 questions altogether. So we really appreciate everyone's participation, and we will get to answering those questions as quickly as possible. We'll try to post them within a week. Thank you so much, everyone.